LGBT care. And so it's a very good place to go. We have excellent staff, very friendly, and it's a very safe environment for everyone and confidential. And also, I think you'll enjoy the experience you have. This is probably about 2010 that my partner and I decided that we wanted to change from a for-profit medical practice to all these cameras, wow. To a nonprofit to help the community more. And as we started thinking about it more, we had been working with Toronto Community Center and the Fairfield AIDS Project over the years, and we're all in different locations in Norwalk. And so we said, what if we put everybody under one roof? I think that would be a lot better for linking patients and clients to care. And so we came up with this idea of the center, and here it is today, 7 years later, and things are just working out great. And I'd like to introduce to you our new medical director. This is Dr. David Rubin. He's been here since October.
Woo!
Tell about what you do, David?
Sure.
Yeah, sure.
First of all, I'm very excited to be working with Circle Care. It's been a great change for me professionally. I come from a background in New York City where I ran an HIV AIDS treatment center and worked in a hospital doing infectious disease consultations. And here, thank you, Scott. And here, I'm focusing on LGBT care with emphases on taking care of patients with HIV, getting people who are appropriate to be on PrEP, HIV prevention, trans care, and just general primary care. So very excited to be in this new practice and to meet all of you if you so desire.
Okay. We also provide mental health services, and so just like the quick introduction to Ed Moran, who is our licensed clinical social worker and mental health therapist. And so if you become a patient of the practice, you can see Ed, and he's an excellent therapist and really easy to talk to. So, there we go.
Everybody has a little bit of drama in their life they might need some help with. It doesn't always have to be like chronic depression or anxiety. Sometimes we just need a little tune-up. Come on in.
Yeah, very good. Thank you. So I guess I introduce Stuart Lane, the Executive Director of the Fairfield AIDS Project.
Woo!
Hi, I've been the Executive Director of MFAP. That's really what most people know us as MFAP. The Fairfield AIDS Project is a little too long to say, so we shortened it. Some people call us MFAP, MFAP, and other things. I won't even mention those. So I've been the Executive Director for 25 years, and we started as I was the only employee back 25 years ago, and we were obviously not in this building. And we now have 9 workers. Our budget back then was like $50,000, and it's now about $1 million. We function mostly because of government grants. We get a lot of help from World Health Clinicians or Circle Care Center, which is Scott's umbrella agency. It's called World Health Clinicians. And we provide a lot of different services for people with AIDS. And over the years, we've branched out and done some other things as well. We are very involved in housing as well, not only for people with AIDS, but for any homeless, disabled. And then also we've just started some new programs, which I'll tell you about. I mean, our basis, our main program is case management. Last year we gave out over $300,000 in direct aid to people with HIV and AIDS in the form of food, and we pay for utility bills, we pay for any medical care that people with HIV might need, and medications, transportation. We've even paid for car repairs for people, and pretty much anything. We're limited to how much money we can give, and we have to pay bills. We can't give it directly to clients. So that's the main thing that we do. Our case managers meet with people with HIV. They come in, everything's confidential. They meet with them, and they basically do a care plan, try and figure out what their needs are, and then a plan to resolve their needs. Our new programs, if you happen to go down to the end, we have some displays explaining them. One is called Drug User Health. And I'm sure all of you know about the tremendous opiate overdose epidemic or pandemic that we've been suffering in this area, and actually throughout the whole country. So this was funded by Department of Public Health, and it's a form of HIV prevention. If we can get people sober or drug-free, or help people that don't want to get drug-free yet but still want to use, and help them to maintain a clean life, get some medical care, and do things that might lead to sobriety, we will do that. And it's a form of HIV prevention in that if we get people sober and off of drugs, then they have less chance of either spreading or catching the illness. Another program we have is nutrition. We have a registered dietitian that works with us, and she meets with people, helps them on whatever their medical issue is, and we see people from Circle Care Center. We refer people to Circle Care Center. We refer people to Triangle. Triangle refers people to us. So that's kind of the synergy that goes on here. We all refer and help each other's clients and patients, and that's what's so great about this building, and so great about what Scott really invented here. The nutritionist is available to anyone that uses any of the agencies in the building, and also anyone that's HIV positive in the community. The last piece that I was going to talk about real quickly is HIV testing. We do free walk-in testing for HIV and hepatitis C, and then if the person is positive, we bring them right downstairs. They get a confirmatory test, and if they want to, which mostly they do, they're able to use the doctors there and the nurses downstairs. So again, you can see how we all kind of synergistically help each other and work with each other. And that's pretty much it.
Thanks, sir.
Go ahead.
Oh, I think it's my turn. Thank you. Hi everyone, my name is Anthony Christie and I'm the Executive Director of Triangle Community Center.
Woo!
Thank you all. Thank you all so much for being here today. I think normally we kind of do an event around this time of year and we call it our annual open house. And this year we really wanted to talk to Circle Care Center and Fairfield AIDS Project about doing this event together, because I think hopefully what you've gotten from Scott and David and Ed and Stuart so far is that there's a lot going on in this building that you should be aware of, and there's a lot of programs and resources and services that are available to people in our community who need them that exist here, and part of the problem is just making sure the people who need those services know they're here for them. So I'm just going to be brief, but I have a few things here to mention. One, I just want to emphasize the point that we don't just share this building with Circle Care Center and Fairfield AIDS Project, but Circle Care Center is also Triangle Community Center's largest funder. So if you love TCC and you don't have a ton of money to donate, guess what you can do to support TCC and everything going on here? You can go downstairs for your health care, and you can have a wonderful doctor who knows the ins and outs of being LGBTQ, knows what tests you need, knows what great medications are for people in the community, and you can get mental health care, whatever you need. And that actually supports all the programs that happen at Fairfield AIDS Project and Triangle Community Center as well. So I just want to make sure everyone knows about that, because we would love to see everyone that supports the center also supporting our partners, Circle Care Center and Fairfield AIDS Project. And what else? So a lot is going on at TCC. We're gearing up for Pride in the Park, if you're not yet aware. June 10th is the date this year. If you're interested in signing up on our website to volunteer or get involved in any way, go check it out. We're also launching a very exciting new program that's going to be an extension of our case management program that we started in partnership with Circle Care Center 2 years ago, in January 2015. That program, in its first 2 years, we've worked with over 300 clients in the community. And we're really just trying to copycat what Stuart and Fairfield AIDS Project have done so well with their case management program in taking care of the HIV AIDS community in Fairfield County. But we're trying to provide those same services for people that might not qualify for HIV AIDS services. So if you know an LGBTQ person in need, send them our way. But an exciting new partnership that we're doing with the State Department of Mental Health and Addiction Services. And again, we can't keep Circle Care Center out of anything because they're such a great partner, but they're supporting this program as well, which is going to be our new young adult services program, which is specifically going to target at-risk and/or homeless young adults in specifically Fairfield County. Some of you may not know, but we actually do have a lot of young adults in Connecticut who are in need. Actually, studies have found that there's about 3,000 homeless young adults sleeping on the streets in Connecticut on any given night, and 1,000 of those young adults identify as being LGBT. So we're starting that program here with our partners, and we're going to make sure that we have young adult competent space and case managers for those folks to come in, get connected to services, and work with us on achieving healthier, independent outcomes without having to go to New York City or wherever they might think they have more access to resources. So that's very exciting, and Lane is here somewhere. Lane's right here. Lane could raise his hand. Lane's leading that new program for us, so if you're interested in learning more about that, please talk to Lane.
Yay, Lane!
I also have to give a shout out to our new Director of Programs and Services over there, Irene Sakinas. It's just absolutely wonderful if you haven't met her yet. She's come to us after spending 8 years at another LGBT organization in New York that we stole her from. And so she has a ton of experience with our community. Let's bring our programs to the next level. All right, let me see what I've crossed off the list so far. In case you may have noticed, the space looks very different today. A new project we're working on is actually every quarter we hope to rotate a local LGBTQ artist's work through this space to help them get more exposure to our community. And so our first artist that's on display is Joseph Dermody, who's been a longtime supporter of TCC, but many organizations in the area. And so you can see some of his beautiful work hung on the walls in our community rooms. If you know an artist who's interested in participating in that program, or if you are interested in buying a piece, we have a sign-up sheet over here. Definitely want to give a shout out to Joseph. And okay, and what else are we doing? Where's Caitlin? Is Caitlin around? Woo! Caitlin, can you tell everyone real quick about the breakout groups? Or were we still doing that?
We might, yeah. So can I plug the other group too?
Sure, yeah.
Okay, so we've been having a lot of parents reaching out with very young transgender and gender nonconforming kids, ages like 6 to 12. So we're launching probably the only Connecticut-specific group for that demographic, March 12th. So if you know any parents who have kids who are gender nonconforming, gender creative, or transgender, you can send them our way. And that's really exciting. The other thing that I wanted to mention, so later today, if you identify as an LGBTQ parent, Irene and I are gonna be tackling a little small informal focus group to talk about what kind of regular programming we can start up for y'all. Right? Yeah.
Thanks, Caitlin.
Yeah, thanks.
So thank you all so much for coming out today. Please hang around, eat the rest of our food, or take it with you, and take the opportunity to get to know maybe one of the organizations that you don't know as well. Find out more about what clinic services are available at Circle Care downstairs, or MFAP, or TCC, and enjoy yourselves. And I really hope we see you all at the next event. Thank you.
Woo!